Hey guys, welcome back to my channel. So today we're going to talk about how to do well on your psychiatry rotation. Before I get started, just a little disclaimer. In this rotation, no stethoscope should be worn, and guys definitely should not wear ties, just in case anything goes out of hand and it can be used as a weapon against you. So in your psychiatry rotation, there's two potential options for where you will be. You can either be in the inpatient floors or you can be in the CPEP. The CPEP is the psychiatric emergency room, and that is usually reserved for patients who check themselves in. It can also be for patients that are brought to the hospital by the police, or they can be people that have come into the hospital because they're exhibiting some odd behaviors related to the usage of recreational drugs. Patients who go to the CPEP, that's the way that they would get admitted to the hospital if they are exhibiting symptoms that are worrisome and warrant further investigation and treatment. The inpatient floors in the hospital in psychiatry are one of the only places where a patient comes in and can be held there against their will. In order to get onto those floors, there are double sets of doors where you enter in on one side, close the door behind you, then unlock the second door and enter in the space where the patients are. This is usually when a patient is deemed to potentially be a danger to themselves or to other people outside. On the inpatient floors, we generally have patients with more severe and significant mental illnesses, such as patients that are exhibiting really psychotic symptoms, having delusions or hallucinations that they need treatment for, patients who are refusing to take medication and therefore their symptoms are not improving, and patients who are very significantly depressed, or patients who are at risk of hurting themselves if they were to leave the hospital. In psychiatry, it's also interesting because you have the opportunity to observe patients who plead the case of trying to get out of the hospital through the court. Hospitals actually do have courtrooms where judges come and lawyers come on behalf of the hospital and on behalf of the patient in order to come to an agreement about whether or not this person does indeed need to be hospitalized or whether or not this person should be taking medication against their will. Another thing that's significant to know in psych is that at times there can be these all hands on deck situations. In my hospital, they call them blue lights, but in other hospitals, they may be called something else. It's basically when a patient is having difficulty regulating their emotions and regulating their behaviors and is becoming a danger to the people that are on the floor. If anyone feels that a patient needs significant help, they call one of these codes essentially. At that point, every person on the floor is meant to respond, and that can include behavioral health associates, that can include doctors, nurses, psychologists that are available as well. Everybody comes in and tries to diffuse the situation. So how do we get good evaluations in psychiatry? So one way to get good evaluations is to ask to talk about topics related to psychiatry. So these topics can include antipsychotic medications or the symptoms that we look for in order to diagnose patients with different illnesses. Psychiatry is really enjoyable because the symptoms that you study at school are symptoms that are kind of easy to identify when it comes time to diagnose a patient with a psychiatric illness. Of course, there's always exceptions and always more difficult cases, but you can identify and say, yes, this patient falls into this category versus that category relatively easily with enough practice. Another way to get good evals is when you feel comfortable, you can try to interview a patient on your own. One of the main purposes of interviewing patients in psych is to get the story of what is going on and as much description as possible. So you want to ask many open-ended questions, and you want to definitely ask the patients why they did what they did in response to the situations that they were experiencing at the time. This can allow you to fully understand what sort of hallucination or delusion the patient is still experiencing, and that can point you in the right direction of how that patient should be treated. You need to make sure that you're asking very specific questions when doing a patient interview, especially in the CPEP. And these are things that your doctors that are observing you are going to be looking for. So you want to ask a patient right out if they are experiencing an auditory or a visual hallucination, for example. You want to ask all of the questions that we learned about in our textbooks about bipolar disorder or about depression, and see if the patient believes that they're falling within those categories and believes that they are experiencing the symptoms related to those mental illnesses. And most importantly, you need to ask the patient if they have any desire to hurt themselves or anybody else outside of the hospital. And another way to get good evaluations is to offer to write notes. So in Psych, you're definitely going to spend the time writing very descriptive notes using the patient's words as much as possible. These are my favorite type of notes because they allow you to kind of just write a story and be as descriptive as possible without as much analysis. You definitely put the analysis in there at the end, talking about what sort of mindset the patient is in, what is it that they're really focused on. But the main purpose is to get down the facts of what happened and what you were able to elicit from the patient during the interview. So how do we do well on the shelf exam? So for this type of shelf exam, you're definitely going to want to do your U-World questions. Focus on beginning to see if the patient in the question stem actually matches the patient interview that you would give if this patient showed up to you in CPEP, and that would help with diagnosis. You also want to do those NBME practice exams if you're able to get your hands on them, or if you're willing to purchase some online. Definitely use those. It's a great resource for practice too. And Anki can be extremely helpful with remembering antipsychotics and remembering different types of drugs or specific drug toxicities, such as neuroleptic malignant syndrome or serotonin syndrome, that you definitely need to be mindful of when prescribing antipsychotic medications. And this is going to be the only rotation, most likely, that I'm going to tell you to spend some time actually memorizing or reading a passive resource where you will basically try to memorize every mnemonic related to these mental illnesses, such as bipolar disorder and depression, and make sure that you quiz yourself on what they mean, and keep repeating that and keep quizzing yourself on that topic over and over and over again, because that's something that you will definitely need for the shelf exam. All in all, psychiatry is one of the funnest rotations. It's super different compared to everything else that we get exposed to in the hospital. So I hope that you guys really enjoy your time in your psych rotation. I hope that you learn a lot and stay safe. And I hope that these tips help you out in your psych rotation. We'll see you in the next video. Bye.